Around the globe, more than 500,000 people now living with coronavirus and more than 85,000 diagnosed in the U.S. One of the youngest patients, a 2-month-old diagnosed in Nashville, while a 17-year-old succumbs to the disease in Louisiana, where they've seen a staggering jump in cases. Now a new warning about Chicago and Detroit. And at the epicenter in New York, the NYPD reporting the first death of one of its employees. And thousands of retired medical workers joining the ranks of those fighting the virus. The mayor of New York City joins us live.
President Trump calls out governors on the front lines of the crisis, saying overnight he thinks some governors are overestimating the virus and the number of ventilators needed. And our latest poll this morning, how Americans think the president is handling the crisis.
High sea outbreak. At least 23 sailors now in isolation on a U.S. Navy aircraft carrier after testing positive for COVID-19. 5,000 aboard the aircraft carrier about to undergo testing.
The hidden faces of the crisis across the country, as so many families are forced to care for their loved ones where they live.
Not being able to hug your mom is like horrible.
What you need to know about how to keep your family safe at home. This morning, the U.S. Surgeon General joins us live.
Game changer. Saints quarterback Drew Brees scoring big for Louisiana, pledging $5 million to help feed children, seniors, and families. As corona cases spike in the Big Easy, the NFL superstar joins us this morning.
And the lab on the front lines, comforting the doctors and nurses working tirelessly to fight coronavirus.
She's changed our lives in the emergency department, and she certainly changed mine.
How she's lending a paw. Wait until you meet Win.
Live in Times Square, this is Good Morning America.
Good morning, America. Happy to be with you on this Friday morning, and we hope to get you ready for a safe and healthy weekend. And Robin, we see so many people are showing their support for healthcare warriors on the front lines.
I mean, neighbors helping neighbors. Here locally in Connecticut, there are 2 restaurants, Fork and Fire and Naples Pizza, and they are taking donations, and they are delivering meals to UConn Medical Center. The workers there, they're calling it feeding superheroes. And also look at this across the pond. People in the UK saluting workers with a standing ovation. Look at that. The mass event called Clap for Careers is making its way, Clap for Carers, I should say. Clap for Carers is making its way all around the world, and it is so great to see that, Amy.
Yeah, they deserve that and so much more, but certainly nice to see them getting that recognition. All right, here's what we know right now at this hour. The U.S. now with more coronavirus cases than any country in the world, with 85,000 and more than 1,200 deaths worldwide. The number of people recovering from the virus reaching now more than 120,000.
The House is hoping to approve the $2 trillion stimulus bill this morning. That's the largest rescue package ever. It includes direct payments to most Americans, more unemployment benefits, and loans for big and small businesses to help them stay afloat during the crisis. But there is a chance that the approval is going to be delayed into the weekend. Robin?
All right. The Navy hospital ship Mercy is expected to arrive in the Port of Los Angeles this morning. It will care for non-coronavirus patients, allowing hospitals to focus on the virus. And there's another hospital ship coming to New York City. We're going to begin this morning with Whit Johnson in Battery Park in Manhattan. Good morning, Whit.
Robin, good morning to you. That Navy hospital ship Comfort is expected to arrive here in New York as early as Monday. This state now makes up more than a third of all coronavirus cases in the U.S. And we're seeing a wave of infections with new hot zones popping up across the country.
This morning, the coronavirus pandemic reaching a painful milestone. The United States now with the most diagnosed cases in the world, more than 500,000 infected around the globe. In hard-hit New York City, the NYPD reporting its first death of one of its own, a 14-year veteran, custodial assistant Dennis Dixon.
When Hurricane Sandy struck, he worked 17 days straight. And since the coronavirus has struck New York City, he's been keeping the NYPD safe.
And Deputy Police Commissioner John Miller now awaiting results of his test after being admitted to the hospital with symptoms on Thursday. More than 85,000 diagnosed in the U.S. 30-year-old Zoe Mungeon, a New York City school teacher, now hooked up to a ventilator.
This was something that came out of nowhere. I wasn't expecting to develop corona-like symptoms.
In Kansas, 74-year-old Dennis Wilson passed away after testing positive and being hospitalized. Doctors initially thought he had the flu and sent him home.
They couldn't do the test because he didn't have any fever. He was fully engulfed with pneumonia in that short a time. We weren't expecting it to be so bad.
But even as the crisis expands, President Trump says he'd like to see parts of the country open by Easter.
This is a country that was built on getting it done, and our people want to go back to work. I'm hearing it loud and clear from everybody.
But the nation's top infectious disease doctor calling that goal aspirational.
Give people some hope, but he's listening to us when we say we really got to reevaluate it in real time, and any decision we make has to be based on the data.
Overnight, the president telling Sean Hannity he believes some governors are overestimating the virus and the number of ventilators needed, just hours after backing out of a deal with GM and medical device company Ventec to produce those life-saving machines.
Governor Cuomo and others that say we want, 30,000 of them. 30,000. Think of this. You go to hospitals, they'll have one in a hospital. And now all of a sudden everybody's asking for these vast numbers.
Cities across the country continuing to shut down, bracing for the worst. Chicago's mayor anticipating 40,000 hospitalizations, ordering the closure of the city's lakefront, adjacent parks, and Riverwalk until further notice after witnessing large crowds gathering outside.
Dear God, stay home, save lives.
In Louisiana, a spike in cases following recent Mardi Gras celebrations, up 28% in a single day. More than 2,300 people there now testing positive, at least 83 dead, including a 17-year-old.
People become more cognizant that they've been exposed. They're more aware of what is going on. And now we're starting to see younger and younger people.
But New York remains the epicenter, where some hospitals are being pushed to the brink.
I think that I've never felt so physically and emotionally burdened in my life. I've never felt so deeply sad and distraught, and it's been incredibly painful to see the suffering of family members who I call from the ICU, hearing their tears, crying with them on the phone, and telling them that if and when we're able to extubate some of these patients, I will try my best to have them FaceTime.
And yet, volunteers are answering the call. In just 24 hours, at least 12,000 retired healthcare workers offering to pitch in. That's in addition to the 40,000 already committed.
The outpouring of support for the people of New York has been so inspiring.
And a glimmer of hope from that Washington nursing home, the site of the first deadly outbreak in the U.S. 90-year-old Geneva Wood, who contracted the virus, fighting back, recovering, now testing negative.
I beat the coronavirus. I have a lot to live for, and God gave me the strength to do it.
Nice to hear that encouraging news there. But more states are now launching aggressive crackdowns on people gathering in parks. In fact, here in New York, the city has taken down about 80 basketball hoops, and the NYPD is now launching its chopper to help manage large crowds. George.
Okay, Whit, thanks very much. Let's bring in the mayor of New York right now. Bill de Blasio joins us from City Hall this morning. Mayor, first of all, our condolences for that victim from the NYPD, the first victim, and all the casualties here in New York City. More than 23,000 cases here in New York City right now, 365 deaths. What more can you tell us about the situation right now?
George, look, here's the reality in New York City. People are answering the call, healthcare workers, first responders, but we have to be real honest about where this is going. I can tell you right now we have enough supplies to get through this week and next week in our hospitals. That's all I can guarantee you. And after that, unfortunately, we think this crisis is going to grow through April into May. That's the truth. And we need the president and everyone in Washington to understand it's just a blunt reality. We're looking at the numbers. We're looking at the human impact. And we can't ignore it. We can't minimize it. We need help now. When the president says the state of New York doesn't need 30,000 ventilators, with all due respect to him, he's not looking at the facts of this astronomical growth of this crisis. And a ventilator, George, means someone lives or dies. It's as simple as that. Someone lives or dies. If they get the ventilator in time, they can live and come through like that amazing woman in Washington State, 90 years old. That's beautiful. But if they don't have a ventilator, a lot of people are just not going to make it.
So you need 30,000. Where are you right now? What do you need from the federal government?
We've gotten in New York City about 2,500 in the last week or so. The state needs 30,000. The city needs 15,000. So we've gotten something, and I'm thankful for that, but it has to keep coming. The president has to make that contract happen with the companies that can create ventilators, not just for New York City and New York State, for the whole country. This is going to get worse before it gets better. And it's literally, we have to understand, without a ventilator, doctors can't save lives. This is the greatest country in the world. We should be producing all the ventilators possible over these next weeks because all parts of this country are going to need them.
You know, it's not just ventilators, Mary. I have the cover of the New York Post right here this morning. Hell on the front lines, talking about these nurses wearing plastic gowns, garbage bags, in order to protect themselves. So many shortages in so many hospitals here in New York.
George, the truth is we have, again, the supplies for this week and next. We got to make sure every hospital is getting them to their extraordinary, heroic medical personnel, the nurses, doctors, everyone in those hospitals, because the supplies are here. We got to make sure everyone gets them when they need them. But again, not too long from now, I may not be able to say that if we don't get constant help from Washington. There's a lot of fear, George. I don't blame any healthcare professional. They're going through hell. Look what they're having to deal with. And we got to make sure the supplies are there every single time when they need them.
Give us a bit more sense. You say this is going to go into May here in New York. The number of increased hospitalizations was about 3,000 yesterday. That was 4,000 the day before. Are we seeing, we know it's still going up, but are we seeing any kind of flattening at all?
George, there's some days we see numbers that make us a little hopeful, but I don't want to give people a false hope and then, they get hit with a ton of bricks and it turns out it's not real. The overall projection, we believe over half the people in this city will ultimately be infected. Now, again, thank God, over half. Thank God for 80%, that will be very little impact in truth. For about 80%, we see this consistently. It's like having, a cold or flu type dynamic, and you get through it in 7 to 10 days. And a lot of those people get right back to work, our first responders, our healthcare workers. But for 20% of the people infected, it's going to be tough. And for some of them, of course, it's going to be fatal. So when you look at these overall numbers, we got to be honest about it. Grows before it comes, before it comes down, we're going to go through a really sharp growth period.
Final question. The president, as you know, has talked about opening some parts of the country by Easter. That's his hope. You just talked about New York City into May. Should we expect New York City to be closed basically through May?
I think, George, we have to be ready for that. And I think it's going to spread in the country. This idea of Easter is unfortunately a false hope. It would be better for the president to be blunt with people, that we've got a really tough battle ahead. Throw in the military, who are not yet being fully engaged, and they're ready, but the president has to give the order. Build those ventilators. Get the supplies all over this country, because people are going to need it in April and in May.
Mayor de Blasio, thanks for your time this morning. Amy?
Thank you, George.
Well, George, unemployment claims are soaring across this country, but our new ABC News poll with the Washington Post has President Trump with his highest approval rating, 48% since taking office. And he has a 51% approval rating of the handling of the coronavirus crisis. Senior national correspondent Terry Moran has more from Washington now. Good morning, Terry.
Good morning, Amy. That approval number for the president, that's the highest he's ever reached in our ABC News poll. And it is the first time that more Americans are telling us they approve of the job that he's doing than disapprove. In a crisis, Americans tend to rally around the president and support him. And even in these bitterly partisan times, our poll shows there is at least some of that spirit of national solidarity. We do find that support for the president drops among those in the harder hit areas, Seattle and New York, among those who are more concerned themselves about getting the virus, and among those who know someone who's caught this virus. That said, these findings in our poll, in other polls, the rally on Wall Street, all this is going to reinforce the president in his belief that he's doing the right thing, that he's going in the right way, pushing to reopen the country in what he calls a tiered approach, county by county, section by section, with surveillance testing, sooner rather than later.
And Terry, we heard the president say that he had a, quote, terrific meeting with state governors about coordinating that response to the outbreak and that there was no contention. But there are real conflicts right now between hard-hit states and the president.
Well, you just heard some of that from Mayor de Blasio, and you'll hear it from Governor Cuomo and others. There are conflict, real tension between governors in hard-hit states and the federal government and the president personally. Look, confrontation is part of President Trump's management style. He likes to drive people, especially people who are vocal. Those governors who are out there calling for the federal government to do more, those are people he's pushing back on. The bottom line for governors who need more, ask for it quietly and maybe praise President Trump while you're doing it. Amy?
All right, Terry Moran in Washington. Thank you. Michael.
All right, thank you, Amy. And let's bring in our chief medical correspondent, Dr. Jennifer Ashton, who is joining us from her home. And Doc, the CDC, they're issuing new guidance on what to do if you think you have the coronavirus, and also when it's safe to end your isolation. So what are those recommendations?
Michael, this has been really tricky because of the lack of testing. So people are symptomatic, they assume they have COVID-19, but then they don't know when they can return to work or leave their homes. So these are the CDC guidelines. If you take a look at them, if you are sick, stay home. If you have a doctor or healthcare provider, call that person, check in with them. You want to avoid public transportation, stay away from people in your home, and limit your contact with pets. If you've had a fever, it is recommended that you should be without a fever for 72 hours without any medication and 7 days since your first symptom, and then you could go back to work. But I want to underscore, if we were able to test more people, we could use testing to determine when people have stopped shedding the virus and then can go back to work. We're just not there yet.
Yeah, that would really help. And, you know, New York has begun experimental treatment. They're taking blood from coronavirus survivors and giving it to people who are sick. So how promising does that look?
Well, this is called convalescent plasma treatment, and it's really hinging on antibodies that people make after they've been exposed to a virus. We think around 4 to 8 weeks after they've recovered from COVID-19. So it's starting clinical trials in New York City right now. It's shown some promise in the past with SARS and MERS, but again, this is experimental. We need to track patients who are moderately ill with COVID-19 to see if there's some promise, but fingers crossed, we need everything we can get right now in terms of treatment.
A lot more to learn, and our fingers are crossed. Doc, thank you for joining us this morning. And Robin, what's coming up?
As you know, Michael, we are just getting started. So coming up, living with the virus, how families are managing to care for their loved ones while they try to stay healthy. Plus, Surgeon General Jerome Adams is going to join us live. And the hero on and off the football field, Saints quarterback Drew Brees and his wife Brittany donating $5 million to hard-hit Louisiana to fight the virus. We're going to go one-on-one with a future Hall of Famer coming up. But first, let's check in with Ginger, who's also at home this morning. Good morning, Ginger.
Good morning, Robin, and good morning, everybody. Let's go ahead and dive in because Gardner, Kansas shows us the vivid lightning, the severe storms that brought nearly 2-inch hail, not just in Kansas, but through Missouri. Today, the tornado threat, especially late tonight, eastern Kansas into Missouri, and then Peoria, Illinois. The Quad Cities need to be on the lookout for tomorrow, a decent-sized threat then, too. The Weekend Getaway is now sponsored by SoFi.
Hey, you. Yeah, you. I opened a SoFi Money account, and it was the first time that I realized I can be earning interest back on my money. This is amazing. I just discovered SoFi, and I'm an investor with a diversified portfolio. Who am I?
They make you feel like it's an honor for them to help you out.
Thanks, SoFi, for helping us get our money right.
Thank you so much.
Well, we're rounding out this week a little warmer than yesterday, 71 degrees. Skies will be partly sunny. I think most sunshine through the midday hours, and then rain returns this evening as we track our next weather maker. So showers possible. Honestly, we could even have a sprinkle after about 5 o'clock, but the real steady rain with this next weather maker falls while you're sleeping. And then tomorrow, a great day to just kind of stay indoors, watch a movie, play some board games. Temperatures will be cooler in the 50s, and we could see over an inch of rain. A little warmer Sunday. I've got the 7-day forecast in just minutes.
For most patients that have sensitivity, it's very common to have a gum health concern as well. If you have sensitive teeth, you probably aren't going to brush your teeth as effectively because it causes pain. And if you see blood, you should do something.